basically a dedication to all the patients who are suffering from this illness. As we know, it's a chronic illness, it's a lifelong illness, and the people who are battling this illness, they are really brave. So thumbs up for these patients.
Thumbs up for all those people, and we are here for you guys. So let's get the conversation started. So Dr. Sadia, tell me, in the first place, why do you think arthritis happens to people?
Arthritis is basically an autoimmune condition. That means that your own body starts attacking your joints and other organs like heart and lungs. So it's not coming.
Heart and lungs too as well?
Yeah,
I only thought that
it's not exactly.
pain in the bones.
It's not limited to joints only. It can start with arthralgias and arthritis, but as a whole, it's a systemic disease. It can involve other organs like lung, heart, skin, eyes, any other organs of the body. Again, it's an autoimmune condition, most commonly genetically inherited. There's nothing environmental or diet related, except few other causes of arthritis. Most of the things, they are related to autoimmunity.
So, okay, now what I want to ask you is that, for example, when people actually experience joint pains, so they will start experiencing them, for example, one day, they've got pain in their shoulder, one day, they've got pain in their knee. So things start gradually within arthritis. So can you just give us a few quick tips that, as into how to probably know that, okay, this is something wrong happening to me and I need to go to the doctor, because over here we have so many home remedies, takor kar lo, garam kapde se, to ye kar lo, things like that. So how do we get to know?
First of all, I would like to emphasize on the fact that arthritis can affect any age. If I'm talking about the autoimmune inflammatory arthritis, that's rheumatoid arthritis. From children to young people, especially females, is common in females, and to elderly population, that's rheumatoid arthritis. And we talk about osteoarthritis, that's the wear and tear arthritis, that commonly affects older people, because it's with time, age, your joint starts, the cartilage.
No, but what are the symptoms? How do we get to know that, okay, probably it's arthritis?
Number one is the pain. You will start feeling pain in the joints, then they become stiff.
In all the joints altogether, or just one by one?
It can start either ways. I mean, if you're talking about osteoarthritis, it will start from the bigger joints.
Okay,
like
I'm sorry to
ankle.
say that, but I don't know, whenever we're talking about such diseases, man, I totally think about my own self in the first place. So this right shoulder of mine, it's like hurting for the last 2 years. So do you think that, God forbid, can be chances for arthritis too as well?
It all depends what happened. Did you injure it? Or
I was playing table tennis.
Exactly.
I was just being rough.
Okay, it's probably a ligament injury, and it will heal.
So we'll talk about that after the show. But other than that, ladies and gentlemen, these are the symptoms. Go ahead.
Okay, so pain, stiffness, swelling. People normally describe that their joint feels very hot and painful. They can't even get out of the bed in the morning. I'm talking about the inflammatory arthritis. Along with arthritis or joint pains, they will start getting fever, lethargy, tiredness. So it's all related. So somebody is getting these symptoms that are not going away in couple of months. They've tried all the medicines and painkillers and everything. They need to go to a specialist and get it properly checked.
Okay, so now let's talk about people who already suffer from different diseases. For example, leukemia, for example, diabetes, anxiety, high blood pressure. How does this disease affect them?
The people who have got chronic illnesses, other illnesses, it can make the other symptoms worse. Like, for example, if somebody's got arthritis and they're not able to walk much, they're at risk of developing obesity, weight gain, and then that can lead to high cholesterol and diabetes and other weight-related problems.